I'm Martin Aerosol. I am a podiatrist. My skills are predominantly in diabetic foot pathology, lower limb vascular pathology, and wound care management. So this is a very young patient, a female lady who had type 2 diabetes with peripheral neuropathy, had a previous history of amputations of the lesser toes. No vascular disease in this case, but she did come in with an extreme pyogenic infection of the first toe, which was, looking at on X-ray, was osteomyelitic, which needed to be amputated. So the patient had a primary debridement, amputation of the first toe, which left us with a deep wound, and then we decided that we would pack the wound with Stimulan, mixed with antibiotics, based on the cultures that were growing from the deep tissue sample. The wound was packed and then sealed with a non-contact, non-adherent dressing, and sealed so the beads were not able to be moved at all. No, tightly packed in there, and a secondary dressing was added to absorb any exudate. So within about 5 weeks' time, the wound was making very good progress. There was healthy granulating tissue, no soft tissue infection, and then when we took an X-ray of the wound, we saw that there was good, healthy bone mineralization, which proved that the beads are actually doing their job, they're working, the antibiotics are eluting into the tissue in the bone where we want it to be. By 9 weeks, we almost had full closure or almost full closure of the wound, very good progress, granulating tissue at the end, and by 15 weeks, there was full closure of the wound. So the patient, like most of the patients I treat, are extremely happy that they don't have to have an extended type of dressing, like a topical negative pressure type dressing on their wound, which they have to carry around. So the benefits of using antibiotic therapy is that the beads are in situ, they stay there, and all that happens is that we change the dressing on a regular basis. So the patients are happy in that sense. This particular case, the patient was extremely happy because the wound healed in record time. She had previous ulcers before and they took a very long time to heal, or they had relapsed into another type of infection. But then in this case, the wound healed without further surgery or relapse of infection.